So let's move on to the role plays now. I'll take the part of a patient or perhaps a relative, and you can take your professional role. Each role play will last 5 minutes. The purpose of the role play is to get you evidence of your ability to communicate effectively with patients and use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare for the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you're not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes. You can look at the card during the test, but you must return it to me at the end of the test. This is your information. For the first role play, it's role play number 1 for medicine. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Sure. May I just confirm your name and date of birth, please?
Certainly. My name is Myra and my date of birth is 24th August 1995.
Thank you, Myra. I understand that you have just been discharged from the hospital 2 weeks ago. Is that correct?
That's right, yes.
That must be very difficult for you.
Yeah, I'm happy to be home and I'm feeling much better than I was 2 weeks ago. But I am feeling really quite tired and I'm a bit worried about that.
Can you tell me a little bit more about the treatment? I understand that you had a mild anterior acute myocardial infarction and then it was treated in hospital.
I had a heart attack. Yeah, and yes, I was in the hospital.
Did you have any procedures? I'm trying to decide whether you had any surgeries or you had any...
No, I didn't have any kind of operation. They gave me some medication and that made me feel better.
Right.
And they hooked me up to some machines, yes.
Right. So the tiredness became 2 weeks ago when you returned home from the hospital. Is that right?
Yeah, I suppose after the heart attack I expected to feel tired, but the tiredness hasn't gone away. So I feel quite anxious that maybe this is the new normal for me.
Sure.
But I'm always going to.
Are you getting enough sleep at all?
Yes, sleep. Maybe not quite as much sleep as I did before the heart attack. But yeah, pretty good.
How many hours on an average work day?
Well, I like to have 8 hours sleep every night, but I think that I'm waking up maybe once in the night at the moment. So it's not complete 8 hours.
And how long does it take you to go back to sleep if you have woken up during the night?
I can take a while. It depends. If I've got anything on my mind, I put on the radios, on the helms.
And before the heart attack, you never felt like this?
No. And the heart attack was completely unexpected.
Sure, well, understandable. Well, in hospital, they would have done all the necessary investigations to exclude any underlying or unrecognized illness that would have contributed to your illness. So let me reassure you that this is purely due to normal bodily reactions. When the body undergoes such an event, such as heart attack, so it is normal that you will be feeling a bit tired for the next few weeks. But eventually, we are expecting that your full energy levels will return.
Okay, so this isn't going to be like this forever?
Absolutely not. And this is why I would like you to address something else with you, which will help you not feeling tired for a long time. It is called rehabilitation program. Have you heard about that?
I think they mentioned something about it in the hospital. But because they talked about walking and swimming, I didn't think it was such a good idea. Because I didn't want to have another heart attack.
Sure, yes. Absolutely. Well, cardiac rehab is all about graduating the necessary exercise level that would be able to tolerate that you would not be getting any chest pain, or what we call is ischemic pain. That is what causes a heart attack. And by graduated exercises, the circulation in the body will improve, and that will not only make you less vulnerable to ischemic events, but it will also improve your overall feeling about yourself as well. And by being able to exercise, you will not be feeling tired as you're feeling right now.
Okay, I do worry though. I mean, the doctor said if I had another heart attack, it would be more severe than before. And because I'm feeling so tired, I do worry that doing exercise is going to make me more likely.
Yes, the cardiac rehab is guided and coordinated by physiotherapists who are well trained into this field, and that's what they do. They are experts at rehabilitating people who have undergone the same problem as you have and who are recovering from a heart attack. But on the top of exercise, we do have to address a few other things, and that is the contributing risk factors to developing another heart attack. Please don't worry about that, because if you have changed your lifestyle, your chances of having another one are quite low, especially if you find ways to maintain normal levels of cholesterol and losing weight and strengthening your heart, as I said, by graduated exercise coordinated by a cardio rehab physiotherapist.
Thank you. That's the end of the role play.